Hello, everyone. My name is Musab Hamas. I'm a nephrologist and a hypertension specialist, and I'm the medical director of the Hypertension Center here at Mayo Clinic in Arizona. I want to take a couple of minutes of your time to share with you very exciting findings from our paper that was published at the Mayo Clinic Proceedings, Innovation, Quality, and Outcomes. The paper titled Developing and Deploying a Hypertension Remote Patient Monitoring Program 101. The main takeaway from this paper is that development, piloting, and scaling up a remote patient monitoring program for hypertension is doable, feasible, and can result in significant improvement in blood pressure control among patients with hypertension in a short period of time. And importantly, this all can be done without placing undue burden on the clinicians. So, what did we find in this study? The paper is two sections. The first section describes really the whole process we went through here at Mayo Clinic to develop, pilot, and then scale up such program. We shared tips and tricks and things that we learned along the way to help any other healthcare system, center, or clinician who's interested in developing such program locally. And then the second part of the paper share our early experience with this program. We included 101 patients who we enrolled in this program here at Mayo Clinic, Arizona in 2023. Now, the exciting findings is the following. Those patients who enrolled in the program had an average blood pressure on enrollment of 153/84. Only 4% of those patients really achieved optimal blood pressure as defined by the AHA guidelines of less than 130/80. During a monitoring median of 38 days, patients graduated from this program with an average blood pressure of 126/75. To put these findings in another word, the percentage of patients with controlled blood pressure increased by 10-folds from 4% at time of enrollment to 46% at time of graduation, again after a median of 38 days of monitoring. This is a huge improvement in blood pressure control, and it really happened without significant increase in number of medications. On average, the medications went up from 2.06 to 2.3. One may ask, well, how did this happen? The program really was a great opportunity to have the nursing team and clinicians connect with the patient frequently, at minimum once a week. And this presented a great opportunity to educate patients on lifestyle, on medication adherence, and other topics related to blood pressure. In addition, having this close monitoring of patients gave the peace of mind both to the patient and to the clinician to up-titrate medications in a rapid way and to optimize the medication selection, as we showed how medications that belong to first-line therapies for blood pressure increased by the time of graduation from the program. Now, I'm sure you're having a question wondering how much communication and messages and back and forth did this program result in, since the patient is receiving a blood pressure monitor that is directly connected to the EHR and there is near real-time data coming into the system. We were pleasantly surprised to find the number of messages were really not significantly higher than standard practice. On average, there was 1.1 message per patient per week during the program enrollment. Also, patients were not referred to the ER more frequently. Only 2 ER visits during the whole monitoring period for the 101 patients was related to blood pressure. So in summary, from a clinical practice perspective, this program was a great opportunity to improve patient care, achieve blood pressure control, improve patient education, and doing all of that without adding this undue burden of excess communication or increased utilization. In fact, if anything, clinicians welcomed such a structured program. On the patient side, there is the huge improvement in blood pressure control and all the benefits that come with that. But very importantly, many of the patients were thankful of such program that allowed them to achieve blood pressure control without having to drive back and forth to the clinic or having to worry really about side effect of medication because they felt that they're well supported, well monitored, and they have this very easy access to the healthcare team. So in summary, I highly encourage you to take a look at this paper and see if developing such program locally would help you and your patients. We are working on several research projects as next step, including comparing the outcome of patients enrolled in this program compared to the standard practice of adjusting blood pressure medicine based on frequent clinic visits or based on self monitoring of blood pressure at home by the patients. We're also doing a qualitative study that is identifying and objectively measuring the satisfaction with this program, both on the patient side and the clinician side. Thank you for taking those 3 minutes to review this paper with me.